Representative LaCombe to the floor on the bill.
Thank you, Mr. Speaker. Members, I want to thank Representative Davis for her leadership in getting the bill to this point. When we were in committee, I thought about bringing this bill myself, and it's a shame that a Democrat can't bring this bill because the people that sent those floor notes out were going to affect everything. I thought about bringing this bill for my best friend, who he and his wife have been trying to have a child for 7 years and have paid upwards of over $300,000 to do. And in the process of doing that, he's paid it all in cash because they want what me and my wife was blessed to have, 3 children, and all they can do is sit there and pay cash out of their pockets over and over. And the worst part about this is he's a physician with the Veterans Association. And if he worked in Texas, or he worked in Alabama, or he worked in Mississippi, or he worked in Arkansas, his health insurance plan through the VA would pay for this. But yet it's blocked in the state of Louisiana because of this reason. Now, you telling me that Texas and Arkansas and Alabama and all these states, they're bastards of abortion? This is not a right to life issue. This is the most pro-life bill we could ever vote on in this chamber. To tell families who are mortgaging their houses to pay everything they got out of their checking account that they cannot somehow have their health insurance plan that they pay for this, or at least a portion of this. We weren't trying to issue a blank check. We were trying to get a portion of this covered. And yet we're blocked here. Sometimes I think those organizations need to stay in their own lane and deal with the things that are there before them. And it is pretty upsetting to me that we've had to go this route and amend the bill and work on things but I'm even proud though, because the bill, even as amended, is going to take care of a lot of cancer patients and other people who are trying to do the same. I had a first cousin that had AML leukemia, and I lived for 6 months with MD Anderson with her while she was getting treatment. And before she had her bone marrow transplant, they gave her the option to say, hey, you're not ever going to have kids again. Do you want to have this procedure to store some of your eggs? And she chose not to, but it was a choice she made, a very important choice that was matter to her family. But the testimony that we heard in committee was from woman after woman after woman who came into committee and stated, hey, this is just something that we want. We need to do this. We want to have children. Me and my husband had these things. And the worst part is, this issue is not always a woman issue. Sometimes the infertility is from the man's side. So this is really a family issue. And it comes into a situation where all we're trying to do is provide families the ability to have a child, something that they're begging to do. And I think it's sort of despicable that some of these groups have changed out of their lanes to come in here to kill something. That's the most pro-life thing that we could do, is to have a couple or to have some people who may have had cancer, who may have had some effects, or have some infertility issues, or have whatever problems they got that are begging to have a child. We argued bills in here, and I heard last week where it was said that, the price is not worth whatever it's worth when it comes to protecting our little girls, and it's not worth what it is to protect our children. Why are we talking about cost or fiscal notes or any of those things when we're talking about a situation where we're bringing life into this world, where somebody like Representative McKee has 3 daughters that's the most beautiful daughters you're ever going to see, who are honor roll students and everything, and they came into this world because him and his wife had to go through that procedure. And the thing is there's tons of people in this room, some of which have said it and some of which have not said it, that have family members, themselves have had it. And I think at the end of the day that this needs to be a learning opportunity to just dig into a bill further than receiving a note from someone who's outside of this room, who's not really in this rail, who's going to affect things like quality of life issues of bringing children into this world. But again, thank you, Representative Davis, for having the guts and courage to bring the bill to this thing because I didn't have the guts to bring the bill. I wanted to bring the bill before. I promised my best friend that I would bring the bill, and I told him that the political realities of me passing the bill was virtually zero. So I was extremely excited whenever I saw Representative Davis bring the bill because of the political realities that she can get, and have someone of her caliber to come down here and have this discussion. Got it where we are now. We're in this process. But in the future, moving forward, when you may bring the bill or whatever, I want everybody to just think for 1 second about the note you receive on your desk and what it really means. I don't think anybody could have expressed that better than Tanner did today. Thank you.
All right.